Here in the Piedmont Triad, we're all connected by the ideas, innovations, and people working to improve our region, from transportation and planning to housing and economic vitality. We bring those conversations to you. Welcome to the Triad Regional Connections podcast, hosted by Audra Adams and Lamar Powell, brought to you by the Piedmont Triad Regional Council.
Hi, and welcome to this edition of the Triad Regional Connection podcast. My name's Lamar Powell. We have a couple of guests in our studio today, and I'm excited to introduce them to you. Adrienne Calhoun, who is the director of the Area Agency on Aging, the AAA. We said that a couple of times at Ptrc. I'm glad she's here. And then Heather Magill, who is the Elder Justice Specialist at the Guilford County Family Justice Center. That's a mouthful. Yes. Thank y'all for being here today.
Yes, thank you. Adrienne, let's start with you. Tell us a little bit about what you do at the Area Agency. Oh, no, I did it. Area Agency on Aging. Or the AAA.
Or the AAA. Just say the AAA.
I know, but for the first thing, I've got to start with that, and then we'll go to the AAA after this.
Across North Carolina, there are 16 AAAs that sits in Council of Governments, just like the Ptrc, and we have a regional area where we provide resources for older adults, caregivers, and those with disabilities, anywhere from the well, active, engaged, and happy, living in their community, to the frail who have to be placed in long-term care settings. We administer federal, state, and local dollars, and we have a mandate to put information and resources out to those who may need it. Individuals want to age in place, live with dignity, independence, and choice, and we're in the place to make connections and provide that opportunity as long as possible.
Absolutely. Now, tell us about you. You've spoken off camera to us about community partners, and I think that's where Heather comes in. So why don't you introduce Heather and how y'all work together?
Sure. Like many of our partners, the Elder Justice Center in Guilford County partners with us to be able to provide that information and resource into the community. Heather sits on our Guilford Commission, the committee that's made up of community members looking at needs and gaps of older adults in Guilford County, whereas we have staff that sits on the Elder Justice Committee to look at elder justice abuse issues in Guilford County. So again, we sit and share staff as well as the information that flows between.
Heather, how long have you been at the Justice Center?
I've been there since 2019. So I lead our countywide multidisciplinary team around elder abuse and also facilitate our case review team. The Family Justice Center started a little over 10 years ago. So we have two locations. We have one in downtown Greensboro and we have one in High Point. The Family Justice Center is a one-stop shop for domestic violence, child abuse, sexual abuse, and elder abuse. And from the very beginning, elder abuse was always at the table and a really important part of our work, which is where the Elder Justice Committee comes in. And all of these different disciplines and agencies work together in our community to prevent and respond to elder abuse.
Wow, that's amazing. So how did you get started in this?
Yeah, I did have background working in family violence. And then I'd also worked with some specific populations, such as those experiencing chronic homeless and faced with many mental health challenges. And what I found is that many of the people I were working with were older adults. And so when the Family Justice Center created a position to expand their elder justice work is when I came to the table, and it was just the perfect blend of domestic violence, family violence, and aging. Oftentimes, aging is seen as a separate issue, but we know in domestic violence services that we never age out of violence and that it happens across the lifespan. Our youngest client has been a day-old baby, and our oldest client has been a 99-year-old man. So we know that it never stops. I think people just stop viewing aging as there's abuse going on. Like, people stop asking. We think of domestic violence as the young mother fleeing in the night, but we forget how broad elder abuse can be, and that we may experience domestic violence grown old into later life.
So when you have people that experience that, what's their first step to getting help?
Sure. We have many people who just walk in the door of the Family Justice Center, and they do not need an appointment. They can just come in and explore what their options are. So at the Family Justice Center, we have law enforcement on site, domestic violence advocates, we have elder justice care managers, we have mental health professionals. It is a wide variety of disciplines. And so they're able to come in and they can tell their story or share what's going on. And we can bring all of those resources to them. We know that elder abuse is really complex. And so we, just like Adrienne said, like we truly need multiple disciplines to respond to it. It's not one person's problem. We often think in a community that adult protective services should be the only response to that. But that's not true. It's a we problem.
So I know we're talking about elder abuse. So let's talk about what that is and why is it often underreported?
Sure. It can be either an act or a lack of actions towards an older adult that causes them harm. And so when I say it's broad, it can be financial exploitation, it could be physical abuse, it could be caretaker neglect, it could be sexual violence. And oftentimes what we see when it comes to elder abuse is it's truly polyvictimization happening, meaning there's often more than one form of victimization that's happening. So when we see caretaker neglect, though that may be physical neglect or not having their physical needs met, we're also seeing that the client is experiencing some form of financial exploitation as well. And so it's just broad. Abuse can be from someone overseas that someone has never met, or it can be, someone where there's just unconditional love. So it's their child, it's their grandchild, it's their caretaker, it's somebody that they really depend on, which is what makes this form of violence truly so hard. Because when you have that unconditional love, it's very hard to report or share. And there's many factors that go into that. It could be that you're in denial, because how can someone that you love and care about be the one that's harming you or taking from you? It could be that hope for change, that it's eventually going to stop. It could be that dependence on care. We know that elder abuse is very underreported. It's about 30 years behind domestic violence as far as research goes and resources. And then people just don't know that the resources exist, or they're scared.
Right. What is, in your experience, like a tipping point or when somebody's ready to come to you? Number one, I want to know that. Number two, how do they know where to come?
Most of the time it's community partners. And so a lot of our work is training other professionals to know that our resource exists so they can guide people to us. So it could be that police respond.
That's what I was wondering.
It could be that it's fire. We work closely with EMS, the hospitals, adult protective services. So most of the time it's because a crisis has occurred, or they are they're hurt. They're in the hospital. They've been moved to skilled care. They've been financially exploited out of everything they have, and they're having to sell their only assets that they have left. So I will say with elder abuse, and again, it's that part because they're either dependent on the caregiver, it's someone that they love, that's what makes it the tipping point, is they just can't take it anymore, or an outside entity has intervened.
What are the biggest red flags that do you have any training that you give to EMS or the hospital? What awareness factor do y'all have so that when they see, what are the red flags that they should be looking for to help facilitate them to get to the right place?
Part of our Elder Justice Committee's work, we have 3 focus areas. So there's education, resources, and response. And a combination of those is this outreach and this training. So we train professionals. We train them on the signs. So we train EMS, law enforcement, fire. We train financial professionals at the bank. We train long-term care ombudsman. We train really anyone that's working frontline professionals that may somehow interface with older adults or their families. So we train them to look for the signs, and they are broad because depending on if it's financial exploitation, sexual abuse. We also do a ton of training on frauds and scams with older adults. when we started developing that training, we looked at what's the number one reason older adults are calling 911, and it was for frauds and scams. So we knew we needed to get out there and get that information out there. And we'll do that to anyone that asks. We do church groups, long-term care centers. Anyone that has a need for that information. We also do a lot of work out of Guilford County, and we now offer that training statewide. It's called Vital Signs, and we train on sexual abuse and how we recognize sexual abuse of older adults, and we train that to anybody working with older adults.
And that you're saying that your facility and the Justice Center has only been open 10 years. And for you to have added all of those trainings and what is your staff like? How many people are in this fight with you?
So the Family Justice Center, the staff that we use to do trainings is actually made up of partners in our community. So it's not necessarily that it's just staff. Our staff is all well versed and trained in all forms of abuse across the lifespan, but we train in a multidiscipline format. And so we're training along law enforcement, along long-term care ombudsman at the Area Agency on Aging, with social workers, with elder law attorneys. So we utilize people that already have that knowledge and that passion.
This is a real triggering conversation.
This is really, it
really is because I'm,
upset.
I am.
Yeah.
My anger's rising because people that you love, your family, you don't want to see this happen for the most part. How prevalent is this in our communities?
Well, we know it's underreported, but it's prevalent. Over the last decade, we've seen over a 60% increase to reports of adult protective services. Our population, the demographics are changing. Like we know over the next 10 years that we're going to have more adults over the age of 65 than, people under 18 for the first time ever. And so I just think people are living longer than ever. Their needs are higher. But it's extremely prevalent.
And the percentage of this happening with a family member or a loved one creating this problem, what is that? I know you mentioned that, but what is that? Is there a percentage? Is it more so a family member?
Yeah, the number one perpetrator in elder abuse is usually someone that they know.
So that, to me, that's mind-blowing.
Or it's a caregiver. Yeah. It is. And I think that's why people don't report it or don't talk about it, because we see it, for years, domestic violence was viewed as it's a private issue and it's behind closed doors. And so elder abuse is like that too. It thrives in isolation. Isolation is the number one risk factor for elder abuse. And that's frauds and scams, sexual abuse, all types of elder abuse is when you're socially isolated.
And so the cause of this, that's the other thing in my mind. What is the cause of this? It's got to be many different things, but have y'all boiled that down?
I would say it's power and control, just like domestic violence. Greed, of course, when it comes to financial exploitation. You see a lot of family conflict later in life when it comes to older adults, of who's managing money or who's spending that money or who's making decisions. So sometimes it can be just family dysfunction or conflict. But I will say when it comes to sexual violence of older adults, domestic violence, it's power and control.
Wow.
What are the systemic gaps that make it harder to prevent or respond to elder abuse?
So I would say one of those things is, again, like isolation, not having resources in our community to make sure people are getting their social needs met. We knew during COVID, like it spiked when people were not checking on others and the phone calls were going. It's also that, everyone is working in their own bubbles and they're siloed. And so when we're not all working together, it makes it easy to fall between the cracks. Perpetrators of elder abuse are likely to get away with things because they are abusing a very vulnerable population. Like we know with sexual abuse that the majority can be those that are experiencing some type of cognitive decline or dementia, and they can't say anything. So it's on us to be able to watch or be checking on folks. Also, just ageism in general is a big gap. Again, we just don't think these things happen. We don't think that older people are attracted to other older people, or younger people are going to do that. But if younger people are going to do that to vulnerable children, they'll do it to vulnerable adults. And so just thinking it doesn't happen or not talking about it. And the same with frauds and scams. We tend to think that can only happen to somebody who does have dementia, but that's not true. The majority of people who are, frauded out of their money, like they're just, the criminals are just really good at what they do. And then they're embarrassed because we don't talk about it.
Yeah, personal experience. I had a parent that was very smart, didn't think he could be taken advantage of, and was. I'd end up having a manager at a drugstore end up calling me and had a conversation with me, and I was just shocked that one of my parents could be taken advantage in that way, but it was a fraudulent thing that was going on. So it's mind blowing. So,
Oh, and I know too, the elder population, even in my family, my mom would get a call and say, "Oh my goodness, something's wrong with my taxes. Oh my goodness, like they told me that I owe this or I owe that." I'm like, "No, you don't. That's not true.
or I have
That's
a
not
ticket in Louisiana they pay
right.
for.
Yeah, like something I missed and I don't know. I don't have the money for that." And it really falls to hopefully integrity-filled people and family members to say, "No, calm down. It's okay. That's what a scam looks like. And if it were real, it would come like this or come like that." So for that, we really, we rely on, especially people with no family and no resource like that. It's so important, the work that you're doing, but the awareness, I feel like right now, even is falling responsibility on, if you know that your parents have a caregiver, if you know that you're not the one checking on them and you are an integrity filled person, you need to have this on your radar so that you are checking in going, "Hey mom, hey dad, how's this going?" Like, and ask them pertinent questions. And I mean, I don't know, is that a correct way to look at it?
Yeah, absolutely. Just being supportive and knowing what to say, or if you do hear of a scam, bring it up at the dinner table. Like, "Hey, I heard about this scam. It's called the grandparent scam. If you ever get a call like this, this is what you say." We talk about doing scripts with people. So like writing down scripts like, "Mom, dad, grandma, grandpa, if you get this call, this is how you can respond," and just giving tips like hang up. Don't pick up the phone for, someone you don't know, but just talking about it. And then also, I mean, just asking someone if they're okay and checking in, like the biggest difference. I mean, it can make a huge difference. Like people will go their whole day and never tell you something's wrong until you say, like, "I've noticed you've been late lately. You're not yourself lately. And are you okay?" But just a little bit of time spent with somebody can mean a huge difference.
So with all that in mind, what resources are available? I know we need to educate people, and that's what we want the audience to get, to learn what's available, what resources available, or how you can help in these different ways.
Maybe what's the first step?
Yeah.
Yeah. So we are all mandated reporters. So if
Okay.
you suspect abuse, you should report that. And so if it's something where you don't feel like it's safe to intervene, or you don't feel like you can ask somebody if they're okay, but you have this gut feeling something's not right or somebody's taking advantage of them, you can make a report to Guilford County Adult Protective Services. You can always call into law enforcement and they can guide you what you need to do. Or you can call the Family Justice Center. You can come into the Guilford County Family Justice Center. And, it can come through many different avenues. So it's usually just starting somewhere. And then just checking with people, like checking on people. It is all of our responsibility to make sure that we live in a community that is safe to age. And like Adrienne said, that like people are aging with dignity and respect, and it's on all of us.
How important is your partnership with the agent, AAA?
It's extremely important. The Area Agency on Aging has been a long-term partner of the Elder Justice Committee. They've been doing trainings with us, big part of our sexual abuse training in long-term care facilities. We work closely with the long-term care ombudsman. And so, I mean, it's really important. We really bounce off of each other. I mean, we lean on each other because it's not one burden to carry this. And that's like what makes our community, I think, so special. Like Guilford County is committed to responding to elder abuse. And I mean, I'm just grateful that we have so many partners.
But how do we make that spread? Like what is, if you had your perfect scenario and it's Forsyth County or it's Davidson or it's, how do we get these counties on board to say, hey, this is a really big problem? You know, do you have a path forward that you could see that could be duplicatable from what Guilford has done?
Absolutely. I think that not every community is structured the same way, and it truly is advocacy. It doesn't have to be one organization that carries that. So it could be the Area Agency on Aging is like houses that or leads that work. It could be law enforcement leads that work in that county. It could be the domestic violence agency says we want to help coordinate and lead that work. I do think having coordinated services is important so people don't fall between the gaps, but we see different communities do it different ways. And the importance is like people speaking up and being at the table saying, we want aging on the table. We want aging a part of this conversation.
Gotcha. What do you think, Adrienne?
Yeah, and I'll add to that because across our region, we may not see it structured just like the Justice Center, but we have our senior centers may be a safe spot to go to. We have Elder Justice Committee. There's one here in Winston. So every community has a starting point. We always say find that starting point of that local resource. And it may not look the same in every community, but those resource connections. And like Heather said, we all have the responsibility to be a reporter, right? So if you walk in my door and I'm concerned about you, I can't just turn you around and send you back out the door. It is my responsibility to connect you and follow through with that. So we see that across the region.
That is so important. And the one thing that y'all are partnering again together with is the Elder Abuse Awareness Walk.
Yes.
Is that correct?
That is correct. And that's something that we're super excited about. We've been doing that for about 15 years at Triad Park. It is I call our signature Elder Abuse Awareness event. World Elder Abuse Awareness is between Mother's Day and Father's Day. So we typically will have this walk the weekend of Father's Day weekend where we bring together, this year we have I'm excited to say, over 40 different exhibitors. The Guilford Justice Centers is one of them, to be able to be on site at the walk to share the type of resources that they have. And so we have a shred truck, so that financial exploitation, let's shred those documents. Let's not leave them laying around. Mm-hmm. We even have medication disposal. Yeah. So we'll have that on site as well. But an opportunity to really come and put a light to this issue. As Heather said, it's underreported. It's not really talked about. You may think it's happening or you're not quite sure what's going on in that home. We don't talk about it. This is an opportunity to talk about it. So the walk is June 13th. Please register. It is open to any and everyone.
And how do we register?
You can go to our website, www.ptrc.org/walk.
Okay.
And it'll take you to the registration. You can register as an individual or you can register a group. We love to have groups come out. We also, if you can't go online, you can call the office. You can call me, 336-904-0300. Just ask for Adrienne. I'll get you registered.
Oh, that is wonderful. Y'all are a great team, and you're very compassionate and passionate at the same time. And I would ask you, Heather, if there is something that is like the one thing that you really want to say, what is it?
I would say just know there is a resource. I often tell people that they may say, I'm not ready to do anything, but it's amazing with older adults. Like if they come in one time and they just see like a smiling face and they know that there are people that care about them and that will fight for them, they come back. And they come back to do what they need to do. And so I would just like really urge people to like know the resources in our community and guide people there when you need them, even if you don't need them yourself. Like somebody that you know is impacted by family violence.
You're so right. And my eyes have been opened to a lot of things just in this conversation, both with you, Adrienne, and with you, Heather. Thank you. Legitimately, thank you. I need to take a minute after this is over because I'm just angry that things like this happen. And I think it's senseless, and I don't get it. I really don't understand why. I think that's the biggest question that I have. It's just why. But we've covered that. There's greed. There's all kinds of motivations for that. But you telling me and me having an emotional response also implants that in my brain, so that when I do see something like that, I know what to do now. So even if it takes me getting angry, I think you should get angry.
Yeah.
You really should get angry, for sure.
What's the best way to get a hold of
Yes.
you in Guilford County?
The Family Justice Center's number is 336-641-7233. So we are open Monday through Friday, 8 to 5, live line. So we want people to call. We want people to walk in.
Do you have a resource online?
We do. We have a
People can look at?
website. If you just Google Guilford County Family
Okay.
Justice Center, it will come up. But we do have a website, and we have information on there too if people are interested in trainings or things like that.
We'll get that up on the screen as well.
Wonderful.
Thank you so much
Yep.
for being here today.
Thank
Thank
y'all.
Yeah.
Well,
I'll let you close us out.
okay. With that, and we are deeply grateful for Adrienne and Heather and for the work that they are doing. If you want to know more information, please don't sit on your hands. Do something about it. And with that, we say thank you, and we'll see you on the next episode. Bye-bye.